India has made rapid strides in achieving the goal of ending AIDS as a public health threat by the year 2030. UNAIDS Director General for Asia Pacific, Eamonn Murphy, has praised India's progress. DD India's Eamonn speaks to the UN official.
The regional director for the UNAIDS in the Asia Pacific region as well as Eastern Europe and the Central Asian region, Eamonn Murphy, is on an India visit, and let me ask him, welcome to India first.
Thank you.
And also when we talk about the efforts that India is making in terms of eradicating or perhaps working towards eradicating AIDS from India, how do you see the progress of India so far?
India has made significant strides. India is not like every other country. When you consider the population size, the geographic, the cultural diversity of the country, you have a whole range of epidemics here. But India has made significant strides. We've got a death rate that's declined over just over a decade by 79%. That means the government, the community are working together to get people into treatment. Prevention rates are slightly slower, but still significantly down, with 44% over that rate. Whereas Asia Pacific as a region is only 13% decline. So you can see India as a major contributor to the regional epidemic has really done a lot.
Also the fact that India is talking about reducing or in fact removing it as a public threat by the year of 2030. It's a long path that India has to walk and has been walking. What are the challenges that you see in this aspect?
Yes, to end AIDS as a public health threat. So AIDS will still be there, but as a public health threat in the community is a significant goal. And India has made that commitment. And there are different targets along the road to that. India has to start by building on the successes it's had. Where is its strengths? Where has it seen that dynamic working? But with the nature of a country like India, you're seeing resurging epidemics in parts of the country like Assam. You have large population states, which are equivalent to a number of countries. You have small population states. So you need different approaches in different places. A surge on prevention is still critical to the response here. The free treatment availability is a significant success and will be sustained by the government. But this innovation and changing the nature of prevention to respond to what's happening in the different epidemics in real time.
Well, of course, the government is perhaps doing what it has to do, but a large role needs to be played by the civil society as well in not just educating, but also providing the much needed support. How do you look at the role of the civil society and the community in this aspect?
Community working with government to design, to implement, to monitor the programs has been a hallmark of the success of India at the federal and at the state levels. And so there are new global targets that India will work towards achieving. The percentage of people who are involved in implementing and also then in monitoring the programs. And that needs to be sustained. And that means an investment by federal, by state governments and by cities as well. And I know the government is looking to expand that role of cities as part of that response, but critically making sure the community is there all the way through. We bring countries from around the world to learn from the India experience and expertise in this area.
Well, of course, that's a fantastic news that India is setting an example for many of the countries especially in the Asia Pacific region as well as in this part of the world. So of course, thank you once again, Mr. Murphy, for speaking to Doordarshan, and we hope the mission to remove AIDS as a public threat by 2030 becomes a successful mission for India. Thank you once again for speaking to Doordarshan. This is Eamonn from New Delhi with cameraperson Kumar Datta for DD India.
Global warming presents